Did you know ABG in slang can mean anybody can get it? Well, today we're going to break down arterial blood gas interpretation in a way that anybody can get it. Because on exams, you're given numbers and expected to figure out what's happening in the body. At a basic level, every ABG question comes down to one thing: what direction is the pH moving and what causes that change? You're always looking at three values: pH, CO2, and HCO₃. Before using any method, you need to understand what each value does. pH tells you the direction, acidic or alkaline. CO2 behaves like an acid. So when CO2 goes up, acidity goes up. Bicarbonate acts like a base. So when HCO₃ goes up, alkalinity goes up. So just remember this: CO2, acid, HCO₃, base. So step one in solving one of these problems, we're going to identify the direction by starting with the pH. If the pH is low, the body is acidic. If the pH is high, the body is alkaline. Next, we're going to find the cause. What's causing the pH to move this way? So we're going to look at CO2 and HCO₃. Which one is pushing the pH in that direction? Here's a clean rule to remember. If CO2 is causing the change, it's respiratory. If HCO₃ is causing the change, it's metabolic. Here's our first example: pH 7.3, CO2 50, and HCO₃ 24. The pH is low, so it's acidic. Now ask, what's causing that? The CO2 is high, it adds acid. The HCO₃ is normal. So the change is coming from CO2, respiratory acidosis. A very popular method is the tic-tac-toe method. Using the same question, the pH is low, so that goes on the acid side. The CO2 is high, which also represents acid. HCO₃ is normal. Now we're looking for the straight line, like tic-tac-toe. We have a line between pH and CO2, and that confirms what we already saw. This is coming from CO2, so it's respiratory acidosis. Now we're going to talk about compensation. Sometimes the body tries to fix the problem. This is compensation. The lungs adjust CO2 quickly, and the kidneys adjust bicarbonate more slowly. If both CO2 and HCO₃ are abnormal, the body is trying to correct the imbalance. So to read compensation, the question becomes, what was the original problem? So looking back at the pH, if the pH is still abnormal, it's partial compensation. If the pH is normal, it's full compensation. Next, we're going to determine the original cause. If pH is normal, you still ask which value is pushing toward acid and which value is pushing toward base. Let's look at a partial compensation example. At a pH of 7.3, CO2 of 30, and HCO₃ of 18. The pH is low, so this is acidosis. CO2 is low, pushing alkaline. HCO₃ is low, pushing acidic. Both values are abnormal, so the body is trying to compensate, but the pH is still outside the normal range, so this is partial compensation. Since the pH is acidic, the original problem is metabolic. Partially compensated metabolic acidosis. One final line to lock in. Partial compensation means the body is trying, but it hasn't fixed the pH yet. This is where many can get confused. When the pH is normal, you don't stop. You look at which side of normal it's closer to. If pH is 7.35 to 7.39, it's leaning acidic. If the pH is 7.41 to 7.45, it's leaning alkaline. The pH is normal, but slightly toward the acidic side. Now look at the values. CO2 is high, pushing acidic. HCO3 is high, pushing alkaline. So both systems are involved. That's compensation. But which one caused it? Since the pH leans acidic, the original problem is respiratory. Fully compensated respiratory acidosis. Here's another example. pH 7.43, CO2 30, and HCO3 20. So the pH is normal, but slightly toward alkaline. CO2 is low, alkaline. HCO3 is low, so it's acidic. So both are abnormal, which indicates compensation. But since the pH leans alkaline, the original problem is respiratory. It's fully compensated respiratory alkalosis. We're going to go into a little bit more practice here. So with a pH of 7.48, CO2 of 30, HCO3 of 24. So the pH is high, this is alkalosis. The CO2 is low, which pushes the body alkaline. HCO3 is normal, so there's no compensation. This is uncompensated respiratory alkalosis. On to the next question. With a pH of 7.30, CO2 of 40, HCO3 of 18. The pH is low, so this is acidosis. HCO3 is low, so the problem is coming from the metabolic side. CO2 is normal, so there's no compensation. So this is uncompensated metabolic acidosis. Our next example, a pH of 7.39, CO2 of 30, and HCO3 of 20. pH is normal, but it's closer to the acidic side. CO2 is low, pushing alkaline. HCO3 is low, pushing acidic. Both are abnormal, so this is compensation. Since the pH leans acidic, the original problem is metabolic. It's fully compensated metabolic acidosis. The simplest way to put this together is first, what direction is the pH going? Acidic or alkaline? Second, what's causing the change? Is it coming from CO2, which acts like an acid, or HCO3, which acts like a base? And then next, is the body trying to fix it? And finally, know your numbers. When you step back, this system is about correction. The body is constantly adjusting, trying to bring things back into balance. And even when something is off, there's still an attempt to restore stability.